A shocking new report by a Wisconsin research group shows how the fentanyl epidemic is ravaging a wide age group in Wisconsin, more than even car crashes or alcohol.
Our Armand Rahman breaks down the deadly impact of the drug by the numbers. Armand?
Eric and Charlotte, researchers at Forward Analytics found that fentanyl is the #1 killer of Wisconsin residents between the ages of 25 to 54. Among those, it disproportionately impacts men of color. Authors say they hope their findings help people realize just how dangerous it is to anyone.
When we saw that it was not only, the #1 killer, but by that wide of a margin, by wide margins, that's really a troublesome figure.
Forward Analytics is calling it the silent killer in only a 10-page report with a very simple message.
We have to have everybody know how dangerous this is.
Fentanyl's mortality rate among men is more than double that among women, and mortality rates for Wisconsinites of color is nearly 3 times greater than white residents. But researchers say it's taking the lives of 25 to 54-year-olds everywhere.
At this point, it is more urban than rural, but you have, in terms of mortality rate, the #2 county in the state is Sawyer County, a rural county in northern Wisconsin. So, it's hitting both.
The director of the research organization, Dale Knapp, says education is the important next step in going from awareness to prevention.
So one of the things we did in the study is we put in a lot of the street names for fentanyl. Apache, China Girl, Tango and Cash, Murder 8. So if you're a parent, you hear these words, it gives you a clue.
He says the legalization of test strips and the wider availability of Narcan has helped. In 2022, they found death numbers steadied. But Knapp says it isn't always the number of deaths that are the most tragic.
At this point, we're probably over 200,000 potential years of life lost because it's hitting people in the prime of their life.
Now, to put it all in perspective, for 25 to 54-year-olds, the second leading cause of death is split between car crashes and alcoholic liver disease. The report says deaths by fentanyl were 2 to 3 times higher than both of those.